7:21, coming up towards 7:22 in Trinidad and Tobago. But let's return to our conversations on gender-based violence, because it is an ongoing conversation and we want to take it a bit further rather than just the superficial old talk that dies away after about 9 days. This time we look at it from a healthcare perspective. The National Women's Health Survey 2018 showed that after family and friends, healthcare workers are the people who are survivors of a GBV the most often in Trinidad and Tobago, that they turn to in Trinidad and Tobago. Under the Spotlight Initiative, PAHO, which is the Pan American Health Organization, they are working with the Ministry of Health and the regional health authorities to develop guidelines for healthcare workers on good practice in the care and support of survivors. Well, we're joined by two personalities to give us some perspective on this. We have Dr. Caroline Allen, Spotlight Initiative Program Manager with PAHO WHO, and joining us via Zoom is Janelle Guy Sampson, Medical Social Worker at the Scarborough General Hospital in Tobago. Good morning to you both. Thank you very much for joining us this morning. And indeed, as I said, we have the doctor, Ms. Guy Sampson, the medical social worker, with us via Zoom, but here in studio is Dr. Caroline Allen, based in Trinidad and Tobago for about 25 years, but can't get rid of the East Anglia accent, and Ipswich Town supporter, for those of you who remember the days when Ipswich Town were a big force in the top division in football in England. Those days have gone, sadly, but we have Dr. Allen with us here this morning. Dr. Allen, good of you to join us. Just give us your perspective. When we talk about gender-based violence, the Spotlight Initiative program, how do you tie in the two issues?
About gender-based violence,
yes,
and healthcare workers?
Sure, yes.
Well, as you were just citing, the National Women's Health Survey from Trinidad and Tobago did show that the healthcare workers are really the first people that, first professional group that people turn to when they are experiencing any kind of abuse. They may turn to police for specific help with safety, but when they need support, when they need medical care, it's the healthcare workers. And often we don't think of those first. We often think of the police, maybe the NGOs, the lobbying organizations, the community groups, and that I think to date there hasn't really been that much focus on the healthcare workers and their very vital contribution that they make in care and support and onward referral to other agencies. And
Ms. Guy Sampson, I'll be interested in your perspective as well, as far as our state of readiness for our healthcare workers or frontline workers in the healthcare sector to be able to deal and treat with these cases, which don't just talk about the physical issue of gender-based violence, but the emotional impact of gender-based violence. How would you describe the state of readiness of our professionals on the front line in that regard?
From a perspective of the TRHA, I would say that we are ready and we have been dealing with gender-based violence. I mean, the spotlight is now on the issue due to COVID, but this is an issue that has been dealt with for many years, and it's a multidisciplinary approach at the hospital. Nurses pick up an issue. Someone might come in for something and not highlight the fact that, okay, I'm being abused. But nurses pick up on body language. They pick up on the fact that the perpetrator might be there with them, and their body language, the things they may not say, the way they look. So they are aptly poised to deal with the issue, as far as I'm concerned.
And if I could just, before I come back to Dr. Allen for her further perspective on it, does it require an extra level of sensitivity training to let healthcare workers be aware, or as you said, look for the signs that if the perpetrator is right next to the woman, for example, she may be intimidated, she may not really want to let out what is really going on. And how do you deal with that? Are you trained to deal with that as a medical professional?
There might not be formal training, but as you are aware, gender-based violence, 95% or more of the victims are females. So there's that female intuition that would kick in. And even though there has not been formal training, which I hope would change going forward, we have been able to pick up on persons' body language, like I said, sometimes the way they are dressed, sometimes the proximity of, where someone stands next to them. They are able to pick up on those cues and act accordingly. They may not highlight it. They might simply ask the abuser, could you get her a bottle of water, please? And then they're able to ask her further, are you sure you're only here for asthma? Is everything okay? Can we do anything extra for you without alerting the person?
Dr. Allen, now, what is your view on that? Because it is a very sensitive situation. If something like that arises, I'm sure sadly it would arise in our public health facilities, maybe even the private ones as well, that you have a situation where, as a healthcare professional, you recognize that something is wrong here. Mm-hmm. How do you intervene? How do you deal with a situation that could be so very sensitive?
I think that the healthcare workers have really, the social workers and the nurses, they're used to dealing with people as well as on a physical level, very much on an emotional, psychosocial support is something that they do every day on a systematic basis. It is part of their general training, but it's something that they have a vocation for. But I do think there's also a space for extra training, so that those areas of sensitivity, of the human rights of the survivors, of things like confidentiality, things like really directing to whatever psychosocial support is there, maybe need to be emphasized and brought to bear in some extra training and capacity building.
We've spoken before in these discussions on a Tuesday, especially since we started this series about 3 weeks ago, in relation to the Spotlight Initiative. As program manager, tell us a bit more about it. Exactly what is its intention? What is it intended to achieve?
Right. Well, the capacity building in the health sector is the cornerstone of what we're trying to do. So one of the components is to build some national clinical guidelines on gender-based violence, on family violence. So we're currently working on that, and consultations are taking place throughout the RHAs, and that's actually how we met Miss Guy Sampson during the Tobago consultation. So those will be rolled out into some specific capacity building activities. They are very much, as well as the RHA consultations, there is a review of the national legislative frameworks and policies and guidance that are already there. So it's not starting from scratch. There's been a lot of good work that's gone on, but we need to build on that. Secondly, we're trying to strengthen the information so that we have proper data, so that we really know what sort of injuries, what sort of emotional violence, etc., are coming to the health system, where it's taking place, the types of people that are being afflicted by this, so that things can be better targeted. So we're working on an electronic information system that actually builds on an existing information system for maternal health. And then we're going to be doing a number of capacity building activities in terms of training, and we're also developing communication products, things like notebooks with extra information for policy makers, for healthcare workers, desk calendars with easily accessible messages. So there's a number of different components, but capacity building is at the core of what we're doing.
And I mean, it's self-explanatory why you need data, because you don't want to be just shooting in the dark, and assuming or using anecdotal evidence, or assuming because in the USA they do X, we should do X, or the UK they do Y, we should do Y. You want that hard data, so that's self-explanatory. But Dr. Allen, what about the attitudes? Because with every different culture, every different society, there's slight variance of attitudes towards gender-based violence. Are you satisfied that there's a real willingness to really combat this issue, to really provide the support to deal with these issues of gender-based violence?
Well, it's very hard to generalize, but I think certainly when we've been to the RHAs, there's a very big willingness among healthcare workers on the ground to tackle this. Very big receptiveness to ideas of integrating patient welfare, patient rights into the whole framework of what they're doing. I think they already do that. Whether it's across the board is another thing, and maybe some people will resist certain parts of it. But I think what the recent events have shown in terms of the groundswell of public outrage at the recent murders, etc., is that the Trinidad and Tobago public as a whole is behind initiatives that will support and care for survivors. And I think that the healthcare system really has a core role to play within that, which perhaps hasn't been highlighted up to date. So really, I think one of the reasons that we are here today is to really throw the spotlight on the healthcare system and the sterling work that it is doing, and really maybe hope to bring some of the Trinidad and Tobago public behind the healthcare system to really support what it's already doing and strengthen it.
And Ms. Guy Sampson, if I could come back to you, because there's always the concern in small communities, and Tobago is a small community, where someone might come in there who you know, and you say, well, oh God, this is an awkward one, because either the person you know is the victim or the person you know is the perpetrator. How do you deal with those sorts of situations? Because there might be, you don't want to cause a scandal in the family, because next thing you will say, why you going and report the person and so on. How challenging is that?
It is challenging to a small extent, because like you said, Tobago is small and the culture is such where everybody knows everybody knows everybody's business. But from a professional standpoint, when someone needs help, they need help. You can't say, okay, I know your brother or I know your sister. At the end of the day, safety comes first. So that has to be put aside, and the professional aspect has to be dealt with, which would be to safeguard that person, and by extension, the other members of the family that might be at risk, for example, children. So there's almost no getting away from it, because even if you don't know someone directly, you might know a relative of theirs. So that really has to be compartmentalized and the issue be dealt with accordingly.
And what do you see as the benefit of the Spotlight initiative in this regard? Because this whole thing about gender-based violence, it's been with us for a long, long time. It's taken recent tragedies to bring it to the fore once again. How do you see this initiative assisting?
I'm really pleased that PAHO chose to bring the RHAs into this initiative. I see, like any spotlight, I mean, it seeks to illuminate a problem. There has been a shift in the way we view gender-based violence within the last decade. In the past, especially, I can speak from a Tobago standpoint, the victim was looked at as deserving of abuse. She can't cook, she worthless, things like that. And then even the way the police dealt with it, it was referred to as domestic violence, showing that, okay, this was a micro level issue to be dealt with in the home. We can't get involved because it's a domestic issue. So I'm really thrilled that now, thankfully, as a result of social media and as a result of PAHO, this initiative, that persons are, well, they would provide us with the tools in terms of some of the things that they bring to the fore in terms of different forms that we could use and so on. But it also gives people the assurance that they can step forward, that they're not in this alone. So you find more and more persons willing to speak out about challenges that they might be having as it relates to domestic violence. And like, as we can all attest to the fact that as a result of COVID, there has been an alarming increase in domestic violence, obviously because the victim and the perpetrators are in the same space for extended periods. So I think this initiative is timely, and we're sincerely grateful that they have chosen, TRHA to be a part of it.
And I'll come back to you, Ms. Guy Sampson, for a final word in a short while. But Dr. Allen, from your own perspective, are we getting a handle on this situation? And because the concern is always when things are highlighted in the media, when there's a level of public outrage, it might diminish after a while because there are other issues, other pressing issues that may take over the public space. And yes, it is a spotlight initiative to shine that light. But sometimes that light can be overwhelmed by brighter light with other issues. Do you get a sense that this might be different this time around? This whole movement, if it can be called a movement?
I feel it is. I think that I've been in the region for, as you said, about 25 years. And the outpouring this time seems a bit different, and initiatives such as your own to have a feature every week and more than once a week. I think the media is really getting behind the issue on a bit more of a sustained basis than maybe it has in the past. I'm hopeful, but I think basically a lot of groundwork needs to be done to set up these things so that they are sustainable, and that's really what the Spotlight Initiative is about, to try and put things in place so that they hopefully will be sustained by the government and other agencies moving forward. We can never guarantee that, clearly, but we need to work on building that capacity. And also one of the things that we're trying to do as well is make sure that things like the training materials will be online. So that one of the things that COVID has done is force us to put a lot of things online, so that as well as face-to-face training workshops, you'll have those materials going forward, so that it's not just a one-off. I think that issue of sustainability is absolutely crucial.
And finally, Ms. Guy Sampson, from your own perspective and from where you are located, based in Tobago at the Scarborough General Hospital, is this something that can be sustained to really change this entire dynamic about the attitudes and the response to issues of gender-based violence?
Of course, I think it is sustainable, and I think we have planted the seed and it could only grow from here. We have to engender in this society that this behavior cannot be tolerated, and once we plant the seed, you would find that each generation is less tolerant. We have seen it with the Black Lives Matter movement. I mean, racism has existed since the beginning of time, but because of the way it has been highlighted in the media, you see that persons have been saying, okay, I'm not my ancestors. So persons are more willing to speak out and to stand up for the victims. So definitely I see only, good things coming out of this initiative.
Well, Ms. Guy Sampson, thank you very much for taking the time to be with us this morning. Let's certainly hope that it's all trending in the right direction, because I mean, as a society as ours, we shouldn't be coping with these levels of domestic violence, but better late than never, I suppose. But thank you very much for taking the time. Dr. Allen, thank you very much as well for taking the time to be with us here in studio as well. And who knows, maybe one day Ipswich Town will be in the English Premiership. Sorry to bring that up, but being a sports fan, being someone who followed English football very intensely in those days when Ipswich Town were big in the dance, they were FA Cup winners in 1978, and indeed Carlos Edwards of Trinidad and Tobago played for Ipswich Town as well, so there is a bit of a connection there. Who knows, it might happen one of these good days, Dr. Allen, but thank you very much indeed for taking the time to be with us. As we go to the break, here's a floral presentation from one of our viewers as we have a look at that. Looks like might be an orchid, a variety of orchid. And now for a look at Castara Bay in the sister isle of Tobago. Just from the lookout, there's a lookout area where there's a nice little seating and so on that you can look down on Castara Bay. That's on the east coast of Tobago. Very nice indeed as we go to the break.